Hi, I'm Paul Atwal-Brice.
And I'm Michael Atwal-Brice, and we're parents to Levi and Lucas Atwal-Brice.
Identical twin boys who are currently both aged 12, aren't they?
Yeah, you may have seen us on TV for fighting for medicinal cannabis for the boys. We're doing this video basically to share our experience.
And also the difficulties and the challenges we are facing, along with all the other hundreds of families out there in the UK where they are fighting to get their children on the correct medication, which they really believe as parents is the best treatment, like ourselves, and to give our children the better quality of life that they all deserve.
So a brief outline of Levi and Lucas. They were both diagnosed with epilepsy age 3, that's when they started the seizures. Since then they've been on different medications. We've tried lots of different medications, lots of different treatments, starting from one medication to now Levi's on 5 different anti-epileptic medications twice a day. It's been a really tough journey. Do you want to speak a bit more about it, Levi, in particular?
It's been really tough, and when we say really tough, we mean really tough. Things like having to use services that is every parent's worst nightmare. Like here in Yorkshire, we've had to use the Embrace service, which is specialised ambulances with their own team of doctors and nurses, where they transport critical ill children. We've had to use that because of the boy's epilepsy not being under control the best way it can be. You know, we are kind of on that journey, that fight and advocating to give our kids the best quality of life they can have, and by that it's also giving them the best treatments of medications which we believe would work.
And I think what we want to get out there is that the general public just assumed that when it was legalised in November last year that everything was fine. Here we are now in March, we're 5 months in, and still there's children without the treatment, including Levi and Lucas, that are still not allowed the medicinal cannabis on prescription, which we and many of us thought that they would be allowed it, that everything would be resolved.
It's very good, isn't it, the media doing the big articles in the press and on TV where they say, yes, it's been legalised, this is great news. But then for families like ourselves and everybody out there who will possibly relate to what we're saying as well, it's not good news, because yes, it's been legalised, but it's not been licensed yet, and there's no guarantee on who's actually going to fund the product neither. So
in our particular area, there's only 5 children going to be allowed on the early access programme for the Epidiolex medication. They do have to have certain diagnoses, so we have had to take Levi back to the hospital to have further testing to get the diagnosis. Levi's got the diagnosis now of Lennox LGS syndrome, which is a very rare form of epilepsy, and yet we're still not having the treatment. Just a brief outline of the boys' epilepsy. They have been ventilated, they're hospitalised a lot. Epilepsy controls a lot of their life. This is their bedroom at the moment. We've got CCTV cameras above the beds, specialised beds. It's a big part of the life.
We've got a through-floor lift as well, because obviously the boys are growing, and every year they're getting bigger and bigger and bigger and heavier. And as you guys know at home who are watching this that have children with epilepsy, you know, after the seizure they are like a dead weight, and you know, it's getting tougher and tougher. And we don't regret any of this whatsoever, because Levi and Lucas are our world. But what we are trying to just do as parents is advocate for the best possible treatments that they can have, and by getting them on medications which we really believe would work. We know there's families out there that are fighting for this as well, you know, and the fact that there's an early access programme where only 5 children can be chosen from that, when there's hundreds of children all in the same category, how can you do that? How can you say, well, actually, child A, you can have it, but child B, you can't have it, when both children have all got the same diagnosis? It's just so unfair in our eyes, you know, and we're all very much about promoting equality and diversity, and to us as a family unit, this kind of goes against all of that, on what we believe in and what we fought over the years so hard for. It's just going against it all.
We've done a lot of media campaigns, both locally and nationally, about this, trying to raise awareness for this. And one of our biggest gripes is, why legalise it in November? Why are we here now in March, so many months later, and still hundreds of different children and adults are not getting the treatment? It's not fair. It's not right. Our boys are still suffering. It affects every part of their life, their education. We get phoned up to pick them up from school because they're fitting, they're having seizures, family days out if they have a seizure that can completely controls their life. Lots of people don't understand what's happening behind the scenes, that parents are having to fight for this treatment. The treatment itself is so expensive as well, at around £33,000 per year per patient.
And to treat a child and give a child the best possible way of life with medications, it should not be down to money. You have one childhood in your life. You can't put a price on a child's life whatsoever. You just simply cannot do that. You cannot put a price on anybody's life, whether they're a child or an adult. This has got to be sorted once and for all. And we are so desperate to get this sorted now. Like families like you out there that are watching, for those of you who are watching this video clip, we would really love to hear your opinions on this, and if you can leave some comments below. The more people that kind of get behind this video and comment, the better the more proactive it can be as one.
Yeah, we'd really like people to share this clip. Tell us your experiences. Are you getting the right treatment that you and your children need? Are you waiting to still hear back from the early access program, or are you indeed like some of the luckier children on the program now and getting the medicinal cannabis? Because there is children out there as well, it's important to say, that are on the treatment, but it's not a fair system.
But there are children out there though that are on it, and it's working so good for them.
It's not a fair system. It seems to be a postcode lottery again, depending on which authority, which NHS department you come under. At the end of the day, we've been in ambulances with our boys, taking them to the resus room so many times now, and it's such a terrifying experience.
But all those services alone, they cost money as well, and they cost a lot of money. So all those services we're having to use all the time, that's a lot of money in itself. Anyway,
the intensive care, the HDU beds,
the Embrace ambulance services, everybody that we have to use, all that comes at a price.
And it's
on
important
the NHS.
to remember as well that the cocktail of medicines that our boys are taking, and many other children are taking, like 5+ different medications, plus rescue medications, the epilepsy nurse service, the neurologist, all the services that come around this.
It all costs money, doesn't it?
Yeah.
And
we're just thinking it's happening in America, it's been happening in Canada and other countries. It's having really good results. Why is this taking so long? Why are we still waiting for this treatment? And why are children still suffering?
So on that note, if you've watched this video clip, please leave your comments below. Let us know what you think. Share this video as well, because the more it can get out there, the more people will see it. And media can be a really positive thing as well. And all of us together, we need to try and action and get this sorted once and for all. We are very grateful that you've watched this video, and
contact your local MPs, let them know what's happening, let them know how the NHS is still failing children and families. This needs to get out there. We've had this opportunity now to speak on this media platform, and we really like to like it, share it, comment on it, share your experiences, and generally just get this topic going.
And we just say, nobody is better than anybody else in our eyes, and that's why we are all about equality and diversity. And we're very grateful you've watched this, and thank you for watching. Goodbye.